हेलो फ्रेंड्स, आप सबका नर्स अड्डा में बहुत बहुत स्वागत है। बहुत से ओबीजी के एमसीक्यूज हम एक ही वीडियोस में कंप्लीट करने वाले हैं। कल वाले वीडियो में हमने बहुत इंपॉर्टेंट टॉपिक्स कवर किए हैं और बाकी के इंपॉर्टेंट टॉपिक्स आज हम कवर करने वाले हैं। सो विदाउट एनी डिले लेट्स स्टार्ट। फर्स्ट टॉपिक, पुरपेरियम एंड पोस्टनेटल केयर। The puerperium is the period extending up to. Your correct option is option C, 6 weeks after delivery. Next question, which organ undergoes involution during the puerperium? Your correct option is option B, uterus. Next question, immediately after delivery, the uterine fundus is usually at the level of. Your correct option is option B, umbilicus. Next question, the uterus descends approximately. Your correct option is option B, 1 centimeter per day. Next question, lochia rubra normally lasts for. Your correct option is option A, 1 to 3 days. Next question, lochia serosa usually occurs during. Your correct option is option A, day 4 to day 10. Next question, lochia alba generally lasts from. Your correct option is option C, day 10 up to 6 weeks. Next question, a foul smelling lochia suggests what? Your correct option is option B, puerperal infection. Next question, breastfeeding should ideally be initiated within. Your correct option is option C, 1 hour after birth. Next question, the first breast milk is called. Your correct option is option B, colostrum. Next question, which immunoglobulin is abundant in colostrum? Your correct option is option C, IgA. Next question, which hormone is responsible for milk production? Your correct option is option C, prolactin. Next question, which hormone is responsible for milk ejection or letdown reflex? Your correct option is option B, oxytocin. Next question, which vitamin is routinely administered to the newborn soon after birth to prevent bleeding? Your correct option is option D, vitamin K. Next question, which is the most important nursing intervention during the immediate postpartum period? Your correct option is option A, monitor uterine tone and vaginal bleeding. Next topic is newborn care. Let's start. A full-term newborn normally weighs. Your correct option is option B, 2.5 to 4 kg. Next question, the normal respiratory rate of a newborn is. Your correct option is option C, 30 to 60 per minute. Next question. The normal heart rate of a newborn is? Your correct option is option C, 120 to 160 per minute. Next question. Apgar score is assessed at? Your correct option is option A, 1 and 5 minutes. Next question. Which parameter is not included in the Apgar score? Your correct option is option C, blood pressure. Next question. The maximum Apgar score is? Your correct option is option C, 10. Next question. The first priority immediately after birth is? Your correct option is option B, clear the airway and ensure breathing. Next question. Which method is most effective in preventing hypothermia in a newborn? Your correct option is option B, immediate skin to skin contact. Next question. Kangaroo mother care or KMC is especially recommended for? Your correct option is option B, low birth weight babies. Next question. The umbilical cord should be kept? Your correct option is option B, clean and dry. Next question. Exclusive breastfeeding is recommended for? Your correct option is option C, 6 months. Next question. Which vaccine is given at birth under the National Immunization Schedule? Your correct option is option D, all of the above. Next question. Physiological jaundice usually appears after? Your correct option is option B, 24 hours. Next question. The normal axillary temperature of a newborn is? Your correct option is option C, 36.5 to 37.5 degrees Celsius. Next question. Which of the following is a danger sign in a newborn? Your correct option is option C, chest indrawing. Next important topic is neonatal resuscitation. The first step in neonatal resuscitation immediately after birth is? Your option is option B, dry and warm the baby. Next question. Which is the most important initial assessment after birth? Your correct option is B, heart rate and breathing. Positive pressure ventilation PPV should be started if the newborn. Your correct option is C, is apneic or gasping. The most important indicator of effective neonatal resuscitation is? Your option is B, increase in heart rate. Next question. Chest compressions are started if the heart rate remains. Your correct option is A, less than 60 beats per minute after effective ventilation. Next one. The recommended compression to ventilation ratio in neonatal CPR is? Your correct option is option C, 3:1. Next question. The preferred site for chest compressions in a newborn is. Your correct option is option B, lower 1/3 of the sternum. Next question. The preferred route for administering adrenaline during neonatal resuscitation is. Your correct option is option C, umbilical vein. Next one. The most common cause of neonatal asphyxia is. Your correct option is option A, respiratory failure at birth. Next question. If the newborn is breathing well and has a heart rate above 100 beats per minute, the nurse should do. Your option is option B, continue routine newborn care. Next question. Which equipment is essential for providing the positive pressure ventilation or PPV? Your correct option is option B, bag and mask. Next question. Hypothermia in a newborn can be prevented by. Your correct option is option B, skin to skin contact. Next question. The Apgar score is assessed to evaluate the newborns. Your correct option is option B, physical condition after birth. Next question. The normal heart rate of a healthy newborn immediately after birth is. Your correct option is option C, 120 to 160 beats per minute. Next question. Which action is most effective in reducing the neonatal mortality rate? Your correct option is option B, effective neonatal resuscitation when needed. Next topic is family planning and contraception. Family planning means what? Your correct option is option B, planning the number and spacing of children. Next question. Which is a temporary method of contraception? Your correct option is option C, copper T or IUCD. Actually, copper T is a type of IUCD. Next question. Copper T mainly prevents pregnancy by. Your correct option is option B, preventing fertilization. Next question. The ideal time for post-placental IUCD insertion is. Your correct option is option A, within 10 minutes of placental delivery. Next question. Which contraceptive method also protect against sexually transmitted infections? Your correct option is option C, condom. Next question. Oral contraceptive pills primarily act by. Your correct option is option A, preventing ovulation. Next one. Which hormone is present in combined oral contraceptive pills? Your correct option is option B, estrogen plus progesterone. Next one. Vasectomy is a surgical procedure performed on the. Your correct option is option B, vas deferens. Next one. Tubectomy involves ligation of the. Your correct option is option C, fallopian tubes. Next one, lactational amenorrhea method or LAM is effective only when the baby is. Your correct option is option A, exclusively breastfed and less than 6 months old. Next one, which contraceptive method is permanent for males? Your correct option is option B, vasectomy. Next one, emergency contraceptive pills should preferably be taken within. Your correct option is option A, 24 to 72 hours of unprotected intercourse. Next question, which method is known as a barrier method? Your correct option is option B, condom. Next question, the full form of IUCD is. Your correct option is option A, intrauterine contraceptive device. Next question, which is the most effective natural method of contraception? Your correct option is option C, lactational amenorrhea method or LAM. Next one, which contraceptive method is known as a spacing method? Your correct option is option C, IUCD. Next one, copper T can provide contraception for up to. Your correct option is option C, 5 to 10 years depending on type. Next one, which contraceptive is inserted into the uterus? Your correct option is option C, copper T. Next one, combined oral contraceptive pills mainly suppress. Your correct option is option B, ovulation. Next one, which contraceptive method is suitable for a couple who desires permanent contraception after completing the family? Your correct option is option C, tubectomy. Next question, which hormone is commonly used in injectable contraceptives? Your correct option is option B, progesterone. Next question, which of the following is a natural method of contraception? Your correct option is option C, lactational amenorrhea method. Next one, a couple using the calendar method should avoid intercourse during the. Your correct option is option A, fertile period. Next question, which contraceptive method has the additional benefit of reducing STI transmission? Your correct option is option C, condom. Next question, which of the following is a common side effect of copper T? Your correct option is option B, increased menstrual bleeding. Next question, the vasectomy prevents pregnancy by blocking the. Your correct option is option B, vas deferens. Next question, tubectomy prevents pregnancy by blocking the. Your correct option is option C, fallopian tubes. Next one, which contraceptive method is considered a barrier method? Your correct option is option B, condom. Next one, emergency contraception is intended to be the. Your correct option is option B, only after unprotected intercourse. Next question, which family planning method is immediately reversible after discontinuation? Your correct option is option C, condom. Next topic is ectopic pregnancy. Ectopic pregnancy is implantation of the fertilized ovum in. Your correct option is option B, outside the uterine cavity. Next one, the most common site of ectopic pregnancy is. Your correct option is option C, ampulla of fallopian tube. Next one, the classical triad of ectopic pregnancy includes. Your correct option is option B, amenorrhea, abdominal pain, vaginal bleeding. Next question, ruptured ectopic pregnancy is a. Your correct option is option B, medical emergency. Next one, the investigation of choice for diagnosing the ectopic pregnancy is. Your correct option is option B, transvaginal ultrasound. Next one, which hormone tests support the diagnosis of ectopic pregnancy? Your correct option is option B, serum beta HCG. Next question, the most common risk factor for ectopic pregnancy is. Your correct option is option A, pelvic inflammatory disease or PID. Next question, which symptoms suggest rupture of an ectopic pregnancy? Your correct option is option A, severe abdominal pain with signs of shock. Next question, methotrexate is used in ectopic pregnancy when the patient is. Your correct option is option B, hemodynamically stable. Next one, the definitive treatment for ruptured ectopic pregnancy is. Your correct option is option B, emergency surgery. Next one, the most common complication of ectopic pregnancy is. Your correct option is option B, massive internal hemorrhage. Next one, the shoulder tip pain in ectopic pregnancy indicates what? Your correct option is option B, diaphragmatic irritation due to intraperitoneal bleeding. Next one, which part of the fallopian tube is most likely to rupture earliest? Your correct option is option B, isthmus. Next question, a positive pregnancy test with an empty uterine cavity on ultrasound should raise suspicions of. Your correct option is option B, ectopic pregnancy. Next one, the priority nursing intervention in suspected ruptured ectopic pregnancy is. Your correct option is B, start IVSS and prepare for emergency management. So the next topic is Hydatidiform Mole or GTD. Hydatidiform Mole is a type of. Your correct option is option B, gestational trophoblastic disease. Next question, the most common symptom of hydatidiform mole is. Your correct option is option A, painless vaginal bleeding. Next question, the uterus in hydatidiform mole is usually. Your correct option is option C, larger than gestational age. Next question, which hormone level is markedly elevated in hydatidiform mole? Your correct option is C, beta HCG level. Next one, ultrasound in hydatidiform mole typically shows. Your correct option is option A, snowstorm appearance. Next one, which ovarian cyst is commonly associated with hydatidiform mole? Your correct option is option C, theca lutein cyst. Next question, the treatment of choice for hydatidiform mole in women wishing to preserve fertility is. Your correct option is option B, suction evacuation. Next question, after evacuation of a hydatidiform mole, beta HCG should be. Your correct option is option B, monitored regularly. Next question, pregnancy should be avoided during beta HCG follow-up because. Your correct option is option B, it interferes with beta HCG monitoring. Next question, which contraceptive method is commonly advised during follow-up after molar pregnancy? Your correct option is option B, oral contraceptive pills. Next question, which complication can develop after a hydatidiform mole? Your correct option is option A, choriocarcinoma. Next question, excessive vomiting in molar pregnancy is mainly due to. Your correct option is option B, high beta HCG. Next question, which thyroid disorder may occur in molar pregnancy due to high beta HCG level? Your correct option is option B, hyperthyroidism. Next question, the fetal heart sound in a complete hydatidiform mole is usually. Your correct option is option C, absent. Next one, the most important follow-up investigation after treatment of a molar pregnancy is. Your correct option is option C, serial beta HCG estimation. Next topic is infertility. Infertility is defined as failure to conceive after. Your correct option is option B, 12 months of regular unprotected intercourse. Next question, primary infertility means. Your correct option is option B, woman has never conceived. Next question, secondary infertility means. Your correct option is option A, failure to conceive despite previous pregnancy. Next one, the most common female causes of infertility is. Your correct option is option A, anovulation. Next one, the most common male factor causing infertility is. Your correct option is option A, low sperm count or oligospermia. Next question, the first investigation for male infertility is. Your correct option is option B, semen analysis. Next question, which investigation assesses tubal patency? Your correct option is option B, hysterosalpingography. Next question, ovulation usually occurs around which day in 28-day cycle? Your correct option is option C, day 14. Next question, which hormone surge triggers ovulation? Your correct option is option B, LH. Next question, which medication is commonly used to induce ovulation? Your correct option is option B, clomiphene citrate. Next question, IVF stands for. Your correct option is option B, in vitro fertilization. Next one, in IVF, fertilization occurs. Your correct option is option C, in the laboratory. Next one, which condition commonly causes tubal infertility? Your correct option is option A, pelvic inflammatory disease or PID. Next question, which lifestyle factor negatively affects fertility? Your correct option is option A, smoking. Next one, the nurse should provide which type of support to infertile couples? Your correct option is option A, emotional support and counseling. Next important topic is gynecological disorders. PCOS stands for. Your correct option is option A, polycystic ovarian syndrome. Next one, the most common symptom of PCOS is. Your correct option is option A, amenorrhea or oligoamenorrhea. Next one, which hormone is commonly elevated in PCOS? Your correct option is option A, LH. Next one, which drug is commonly prescribed to improve the insulin resistance in PCOS? Your correct option is option A, metformin. Next question, endometriosis is defined as the presence of endometrial tissue. Your correct option is option B, outside the uterine cavity. Next one, the cardinal symptom of endometriosis is. Your correct option is option A, severe dysmenorrhea. Next question, uterine fibroid is also called. Your correct option is option A, leiomyoma. Next question. The most common symptom of uterine fibroid is? Your correct option is option A, menorrhagia. Next one. Pelvic inflammatory disease primarily affects the? Your correct option is option A, upper genital tract. Next question. The most common cause of PID is? Your correct option is option A, ascending bacterial infection. Next one. Which organism commonly causes PID? Your correct option is option A, Neisseria gonorrhea. Next one. Persistent HPV infection is the major risk factor for? Your correct option is option B, cervical cancer. Next question. The screening test for cervical cancer is? Your correct option is option A, pap smear. Next question. HPV vaccine helps to prevent which cancer? Your correct option is option A, cervical cancer. Next question. The best lifestyle advice for women with PCOS is? Your correct option is option A, weight reduction with regular exercise. Next important topic is reproductive tract infections or sexually transmitted infections. The most common symptom of reproductive tract infection is? Your correct option is option A, vaginal discharge. Moving to the next question. Which organism commonly causes vulvovaginal candidiasis? Your correct option is option A, Candida albicans. Next question. Thick, white, curdy vaginal discharge is characteristic of? Your correct option is option B, candidiasis. Next question. Which STI is caused by Treponema pallidum? Your correct option is option C, syphilis. Next one. The screening test commonly used for syphilis is? Your correct option is option A, VDRL. Next question. The drug of choice for syphilis is? Your correct option is option A, penicillin G. Next question. Which organism causes gonorrhea? Your correct option is option B, Neisseria gonorrhea. Next question. Which STI commonly presents with painful genital ulcers? Your correct option is option B, genital herpes. Next one. HIV primarily attacks which cells? Your correct option is option C, CD4 T lymphocyte cells. Next question. Which investigation is commonly used for HIV screening? Your correct option is option A, ELISA. Next one. Which method is most effective in preventing the sexually transmitted infections? Your correct option is option C, condom use. Next question, pelvic inflammatory disease or PID may lead to? Your correct option is option A, infertility. Next question, which STI is caused by Chlamydia trachomatis? Your correct option is option B, chlamydial infection. Next question, the syndromic management of STIs mainly aims to? Your correct option is option B, treat based on symptoms without waiting for laboratory confirmation. Next question, which preventive measure is recommended for both partners in STI management? Your correct option is option B, simultaneous treatment of both partners. तो इसी के साथ मोस्ट एक्सपेक्टेड 500 OBG MCQ सीरीज़ को एंड करते हैं। और अगर आपको ये सीरीज़ पसंद आए और मोर OBG क्वेश्चंस अगर आपको चाहिए तो कमेंट करके बताइए। थैंक यू फॉर वॉचिंग द वीडियोज़ एंड सब्सक्राइब फॉर मोर सच वीडियोज़।